Have you ever pondered the significance of regenerative medicine or wondered who was the pioneer behind it? It's time to unveil the story of Dr. Paul Niehans. Born in the picturesque landscapes of Switzerland in the year 1882, Niehans was a curious mind from the beginning. He initially embarked on a journey to understand the divine, studying theology. However, the human body and its intricate workings intrigued him more. This fascination led him to switch his path, and he dived into the world of medicine. His keen interest and zeal for learning made him stand out from his peers. He was not just another medical student, he was a promising one. A promise that suggested a future where he would leave an indelible mark in the field of medicine. His story was just beginning, but little did the world know, a medical pioneer was in the making. A promising student, Niehans was destined to make a mark in the field of medicine. Niehans' journey in medicine saw him rise to become a leading glandular surgeon in Europe. This was no overnight success story. Instead, it was a journey that began with a detour. Although he initially studied theology, Niehans switched gears and found his true calling in the realm of medicine. The transition was not just a change of course, but a stepping stone towards a future that would see him become a medical pioneer. In the early stages of his career, Niehans focused on glandular surgery, a specialized field that deals with the body's hormone-producing glands. His skill and dedication to his craft were quickly recognized, propelling him into the spotlight as one of Europe's leading glandular surgeons. This wasn't just a job for Niehans, it was a passion, a mission that he was determined to excel in. But Niehans was not content with just being a surgeon. He had a curious mind, one that was always looking for ways to push the boundaries of what was possible in medicine. He began experimenting with glandular transplants, an innovative approach for its time, which involved replacing damaged or diseased glands with healthy ones. His groundbreaking work in glandular surgery and transplants made him a respected figure in the medical community. But Niehans didn't stop there. His innovative approach to medicine led him to experiment with cerebral cells and various organs. He was on a relentless quest for knowledge, a pursuit that was driven by his desire to improve and save lives. Despite the skepticism and challenges he faced, Niehans remained steadfast. He was a visionary, a trailblazer who was not afraid to challenge the status quo. His work was a testament to his dedication and commitment to advancing the field of medicine. Niehans was making waves in the medical world, but his most significant work was still ahead of him. His journey was far from over, and the next chapter would see him delve into uncharted territory, a venture that would forever change the course of his career and the field of regenerative medicine. In the 1930s, Dr. Niehans developed a method that would change his life and those of his patients forever. In the heart of Switzerland, a revolution was brewing in the field of regenerative medicine. This revolution was led by none other than Dr. Paul Niehans. Dr. Niehans was inspired by the potential of the human body to heal itself. He wondered if it might be possible to help this process along, to give it a boost. And so he turned his attention to the development of what would later be known as the Niehans method or fresh cell therapy. This innovative method involved injecting fresh cells from sheep embryos into the human body. The idea was to stimulate the body's natural healing processes, to encourage regeneration and rejuvenation from within. Dr. Niehans believed that these fresh cells could replace or repair damaged cells in the human body, leading to improved health and vitality. Dr. Niehans was not just a dreamer though, he was a doer. He began to experiment with this method, first on animals and later on humans. Despite the lack of scientific evidence, he saw potential in this approach. He saw patients improving, he saw lives changing, and he believed in the power of his method. His belief was so strong, in fact, that he began to use fresh cell therapy as a treatment option for his patients. He treated notable individuals, kings and popes, writers and politicians. His patients ranged from Pope Pius XII to King Ibn Saud. All were seeking something, a cure, a boost, a chance at a longer, healthier life. The Niehans method was not without controversy, however. There was no scientific evidence to back up Dr. Niehans's claims. Many in the medical community dismissed his method as quackery. They questioned its effectiveness, its safety, its very basis. But despite the controversy, despite the lack of evidence, the Niehans method attracted attention from all corners of the world. People were intrigued by the possibilities, by the potential for a new way to approach health and healing. They were drawn in by Dr. Niehans's unwavering belief in his method, by his dedication to his patients, by his vision for a healthier world. Despite the controversy surrounding it, the Niehans method attracted attention from all corners of the world. And so, the legacy of Dr. Niehans continued to grow, his method continued to be used, and his name continued to be known. Niehans' method was not just a medical procedure, but a beacon of hope for many, including some of the most notable individuals of his time. Dr. Paul Niehans was no ordinary surgeon, and his clientele was nothing short of extraordinary either. His pioneering work in regenerative medicine brought him into the orbit of some of the most influential figures of the 20th century, each seeking a taste of his revolutionary fresh cell therapy. Let's take Pope Pius XIV, for example. In the early 50s, the Pope found himself under Niehans' care, receiving his breakthrough treatment. The impact was so profound that Niehans was appointed a member of the Papal Academy of Sciences, a testament to the regard in which he was held. But it wasn't just the Pope who sought Niehans' expertise. King Ibn Saud, the first monarch and founder of Saudi Arabia, also turned to Niehans for his innovative therapy. A man known for his strength and resilience, King Ibn Saud's choice to trust Niehans was a powerful endorsement of the Swiss surgeon's work. And then there was Charles de Gaulle, the stalwart French president, who too was treated by Niehans. De Gaulle, a symbol of resistance and a figurehead of French nationalism, was another feather in Niehans' cap, solidifying his reputation as a physician to the world's power players. But it wasn't just about the who's who of Niehans' clientele. It was about the hope he offered, the potential for a new lease on life. His method, though controversial, was a beacon of hope in a time when hope was often in short supply. It was a symbol of the relentless human quest for longevity and vitality. Niehans had become a figure of global interest, his method a topic of heated discussion. His work with these notable individuals was not only a testament to his skill as a surgeon, but also a reflection of the hope and promise his method embodied. It was a method that, for better or worse, would leave an indelible mark on the annals of medical history. Though Niehans passed away in 1971, his legacy lives on, as does the debate surrounding his method. The Niehans method, developed in the 1930s, is a topic of much controversy even today. The practice of fresh cell therapy, which involves injecting fresh cells from sheep embryos, was revolutionary and radical. It caught the attention of the world and garnered Niehans a diverse clientele of high-profile individuals, from Pope Pius IV to Charles de Gaulle. However, despite its initial popularity, the Niehans method has come under scrutiny in the modern medical community. Some medical experts have gone as far as to classify it as quackery, citing a lack of evidence for its effectiveness in treating any health problem. This skepticism is not unfounded. After all, in the realm of medicine, it's evidence that separates a breakthrough from a blunder. Adding fuel to the fire, the American Cancer Society conducted its own investigation into the Niehans method. Their findings were not in favor of the Swiss surgeon's unique approach. According to them, there was no objective benefit in using fresh cell therapy for cancer treatment. This conclusion further challenged the credibility of Niehans' work, casting a shadow over his otherwise illustrious career. Yet, even with these criticisms, it's undeniable that Dr. Paul Niehans sparked a conversation. He pushed the boundaries of what was considered possible in medicine, and in doing so, invited both admiration and controversy. Whether celebrated or censured, his work continues to inspire curiosity and debate among medical professionals and enthusiasts alike. Dr. Paul Niehans, a pioneer in regenerative medicine, left a mark on the world that continues to spark debate and inspire curiosity till this day. Dr. Paul Niehans, a man of science, a man of controversy, and a man of undying curiosity. His life was a testament to the power of exploration, of pushing boundaries, of seeking answers where others saw only questions. He was a pioneer in the field of regenerative medicine, daring to venture into uncharted territories, developing the Niehans method or fresh cell therapy. His work, while controversial, attracted the attention of the high and mighty, from popes to kings, authors to statesmen. Yet it was not without its detractors. Many in the medical community questioned the efficacy of his methods, even labeling them as quackery. But Niehans remained undeterred, steadfast in his belief, unwavering in his pursuit. His legacy, while contentious, is undeniable. His name, a symbol of relentless curiosity and unyielding determination. Dr. Paul Niehans, a name etched in the annals of regenerative medicine, continues to inspire and provoke thought long after his departure from this world.